Hi, welcome to my introductory session to give you some practical ways to help manage your post-COVID long-haul symptoms. So as the weeks have gone by, cocooned in Australia, I've been increasingly concerned about the long-tail effects of those of you who've had COVID-19. It wasn't until my brother shared a couple of posts from the COVID-19 long haulers group that I was prompted to join up and get a better idea about the sheer number of you who are being affected. Of particular concern to me was the lasting chronic fatigue that so many of you have been grappling with, both the physical fatigue, cognitive, and also the brain fog. I've had a personal and professional interest in the management of chronic fatigue syndrome for over 25 years, and I felt compelled to produce this presentation for you in the hope that in some small way I can offer you some practical advice and strategies to put into practice and help you feel more stable and in control of your everyday activities. So let me just introduce myself. My name's Hazel and I'm an occupational therapist. I trained in the UK and worked for the NHS for about 10 years before moving out to Australia. For those of you who may not have crossed paths with an occupational therapist or OT before, the fundamentals of OT is to look at the person's ability to carry out their functional everyday activities. Rather than using exercise, we analyse activity, physical, cognitive and emotional, breaking down everyday activities and grading them to enable an individual to gain or regain their independence and take control of their life. Now, I've read countless posts on your Facebook page describing lives that were busy and bodies that were fit and which are now extremely debilitated. People that are struggling with the simplest activities such as walking up the stairs or concentrating on the contents of an email. And I've also read some really positive and practical posts on your page about the importance of pacing, letting go, not expecting too much of yourselves at the moment, and things like that. Now, I'd like to expand on this in a structured way by looking at the principles of energy conservation, pacing, and effective resting, but also on the importance of finding your baseline activity level. Because once you find this, you can start to regain a feeling of control. So first of all then, let's have a little look at letting go. Your bodies are in the post-viral phase of a virus that very little is known about. You're experiencing symptoms that you may never have experienced before. Your test results may be coming back clear, despite symptoms to the contrary. I would just like to affirm that what you are experiencing is real. Your parasympathetic nervous system is causing palpitations, tachycardia, chest pains, low oxygen saturation levels, etc. And just because the medics can't tell you why you have these, it doesn't mean it's not real or that it must be anxiety. It simply means that the doctors don't have the answers, and doctors don't like to admit that. So a quick word now, if you're the partner, housemate, work colleague or employer of someone who's experiencing these long tail symptoms. Thank you for taking the time to watch this and wanting to understand how you can help. A good start is by providing your support and believing. You may well have had COVID too. You may know a lot of people who have had COVID and that have recovered well. That is brilliant. Be thankful, because how someone responds to COVID seems to be a lottery. What long haulers are experiencing could very easily be your story. Chances are you know your partner, friend, work colleague well enough to know that there's no way that anyone could or would want to dream up this set of symptoms like they're experiencing. No one wants to be ill for a moment longer than necessary. Most sufferers until the moment COVID struck, were fit, energetic, active and hardworking. Whatever frustrations you may have that they're not getting better or pulling their weight, their frustrations will be tenfold more and likely to be accompanied by a lot of guilt too. Please watch the following tutorials on energy conservation and pacing, and please help to give this long hauler, the space and the time that they need to recover from this. And now to those of you who are experiencing long tail symptoms. You may not have the answers as to why your body is behaving the way it is, but you do have the ability to regain control of your life. The first step has to be that of letting go. This is a virus like no other. So you just need to stop trying to fight it and stop trying to tell yourself that it's time you're able to do X, Y, or Z again. This is the time to listen to your body. If you find yourself relapsing, if your symptoms are coming back, if you do a day's work only to find yourself having to spend a day or two in bed later on in the week, this is an indication that you're doing too much. Now, this may be really scary to hear, but if you keep going, not listening to your body, this is likely to develop into a chronic fatigue syndrome. I can't emphasize enough that what you do in these first few weeks and months could have lasting implications on your long-term recovery. As difficult as I know it is, you need to try and change some of your mindset and personal expectations about what you should be doing. At the moment, your body needs time to rest. You need to give and space to recover. Now, when you're doing resting, this needs to include times of relaxation, where you'll give your body and your brain the space it needs to relax. Later, I'll talk about effective relaxation and the importance of switching off external stimuli while you're doing this. So effective resting is not simply watching TV or reading a book or listening to a podcast. Over the next few weeks, this is an investment into your ability to return to everyday normal life. You can't fast track it and you can't fight against it. What you can do, however, is to regain control of your fatigue. So I just want to talk for a few minutes now on finding your baseline, because I know a recurring issue of long-haul COVID is relapsing. And whether that be symptoms coming back or being completely overwhelmed by fatigue. The most important thing you can try and do at this stage is to find your baseline activity level. You need to work this out to start to feel more in control of your body and to reduce the chance of relapse. So let's have a look at the next couple of slides at the typical peaks and troughs of life with post-viral fatigue. So what tends to happen is you start to feel a little bit better, so you try and do a little bit more the next day. You go for a longer walk, maybe you meet up with a friend, you spend time chatting on the phone, or maybe even going into the office and you spend a few hours in the office. And then as the day wears on, you're feeling energized because you've got a lot of adrenaline in your system. And it's only when you stop that burst of normal life with chronic fatigue, it might be the end of the day, it might be 24 or 48 hours later, that the payback starts. And that when that happens, your symptoms start to return, the fatigue is overwhelming, and you feel as though you've gone backwards again. And then, forced to rest, you might spend the next 2 or 3 days in bed, and then you start to improve. The symptoms ease, you start to do a bit more. You might be feeling really frustrated and guilty about having had to have had more time out, more days off work, more time in bed. So you start to go for it again, have a productive day, and then once again, your symptoms return and down you go to another couple of days of very limited activity levels or days back in bed. And this seems to be quite a recurrent issue from looking at a few of your posts. So your baseline activity level is the level that you can function at comfortably without those symptoms and fatigue. So like on this other graph, it's where, you're going to have times where you're feeling you can do a bit more, and then you're going to have times where you feel tired, times where you're doing more, times where you feel tired, but you're evening out that highs and lows, the peaks and troughs, into a more steady rate. So your baseline level is very individual, and it's therefore going to be really different for each person watching, and really tricky to try and explain in a group setting. So when preparing this talk, I initially went through this in more depth, but it came across as quite hectic. So I thought it would be better to try and cover it in more depth in a separate little video. Basically though, to find your baseline activity level, you need to peel back the quantity and duration of activities that you're doing throughout the day. If you continue to feel fatigued and symptomatic, you're still doing too much, and you'll either need to rest more frequently between activities or reduce the number of activities that you're trying to fit into the day. When you cut back to a level that you feel more in control, that's your baseline activity level. And it's worth, once you think you found this, use a notebook to write down the structure of rest and activity which makes up your baseline. And keep this diary because it will give you a greater awareness of where your limitations lie and where you need to start pacing, prioritising and planning to regain control. And once you have a comfortable baseline, like your status quo, your body has the space it needs to function. Systems such as the parasympathetic nervous system, in time, will calm down and will start to behave less erratically. In terms of building up your activity levels from here, it's a very, very slow and steady process, which will realistically take place over months rather than weeks. As slow and frustrating as it is, what you're trying to avoid is this tipping over into chronic fatigue syndrome, or ME. So, as a rule of thumb, if you're experiencing more fatigue, you need to return to your last safest level of activity. If you're experiencing other symptoms again, such as breathlessness, chest pain or muscle pain, leave it for another day or two before you increase any activity levels. And if you experience a crash, then return to your baseline activity level. Now, when I do the tutorial on finding your baseline, I'll also look at principles of safe and gradual grading of cognitive and physical activities. But firstly, I'd recommend that you watch the next short presentations that focus on practical ways to conserve your energy. These go through the main aspects of energy conservation. There's 4 of them, so we'll look at pacing, prioritising, planning and positioning. Each of those are important to help you conserve energy. I'll then give you some examples of how to put these aspects of energy conservation into practice with some common everyday activities. So hopefully by the end of this series of sessions, you'll have some ideas and more confidence of how to implement these energy conservation measures practically into your daily life. Thank you for watching, and I hope to see you again soon.